We're just 1 month into the school year, though Ontario schools make up 1/3 of all active COVID cases right now in the province. Though there's mounting evidence that a vaccine for younger children is on the way, and multiple doctors are calling it a game changer in the fight against this pandemic.
If you think of COVID like a fire, it needs sort of dry kindling to burn. If a vaccination sort of soaks all the logs with water, so it makes it harder for things to catch. You get all those kids vaccinated, it won't spread in the schools as much, and things will be much better for them.
As of today, there's 1,637 active cases of COVID-19 in Ontario schools. That's a small percentage of the entire school population. Ontario has managed thus far to flatten the curve during the fourth wave due to public health measures and vaccination rates. However, cases in children continue to rise. Kashif Prasadda is an emergency room doctor in a Toronto area hospital.
What you'll notice is that areas with lower vaccination rates are being hit first. So communities where the adults aren't as vaccinated, their kids are catching it more and they're spreading it to their classmates. So it's going to keep happening. The rates are starting to increase now. I fear in a few weeks it's going to be even worse.
What's going to be the role of parents in this catch-up immunization approach? What's going to be the role of pharmacists, primary care, the government in funding this? We need to really have a cohesive kind of approach where we're really all on the same page and everyone kind of understands their roles.
Dr. Kate Allen works with the Centre for Vaccine Preventable Diseases at U of T. She co-authored this recent report on the challenges Ontario is facing maintaining regular vaccination rates for school-aged children during the pandemic.
In Ontario, we have 3 school-based vaccines that we deliver in grade 7, and those are delivered in schools. And we know that during the pandemic, most of those school-based immunizations were canceled because of public health measures.
Allen notes that we can learn from the accessibility challenges families have been facing, getting their youngsters the regular vaccines for things like measles, mumps, and other historic illnesses, as we now focus on planning to vaccinate children aged 5 to 11 once it's approved.
Allowing these things to happen in school-based settings, community-based settings, pharmacies, primary care. I think as many places and sites as we're able to offer the COVID vaccine would be of benefit.
Dr. Prasadda estimates that we could see a vaccine for younger children approved in the next 3 to 4 weeks. Now, one thing multiple healthcare providers have been calling for is rapid testing in our schools. Tomorrow morning, just after 8 a.m., Dr. Moore, Ontario's Chief Medical Officer of Health, will be making an announcement. Now, he hasn't confirmed what the announcement will be about, though there are reports that it could be about a strategy around those rapid tests and a response should a school have an outbreak of COVID. You'll be able to watch it live on citynews.ca at 8:45. I'm Adrian Ghobrial for City News.